Finals SAQ9 Coronary Artery Bypass Grafting. A. What are the theoretical advantages of off-pump coronary artery bypass grafting compared to on-pump bypass technique? Advantages of off-pump coronary artery bypass includes avoidance of complications of cardiopulmonary bypass, which includes platelet dysfunction, consumption of clotting factors, accelerated fibrinolysis, blood transfusion due to coagulation defects, renal dysfunction, SIRS, air emboli, neurological dysfunction, fluid overload or fluid depletion, and electrolyte disturbances. Off-pump technique allows for earlier extubation, shorter hospital stay, or avoidance of ICU stay, and reduced medical costs. There is reduced morbidity and mortality. B. What causes hemodynamic instability during off-pump coronary artery bypass? Causes includes ischemia due to vessel anastomosis. Shunts are used to reduce ischemia. Manipulation of the heart for access to lateral and posterior aspects. Ventricular filling must happen vertically upwards due to the lifting of the heart vertically out of the pericardial sac. Mitral and tricuspid annulus deformation leads to reflux. Another cause is impaired filling due to the immobilization device. Arrhythmias may occur, which is induced by myocardial ischemia, manipulation and reperfusion. Lastly, bleeding can cause hemodynamic instability. Additional information. During off-pump surgery, there is no use of cardiopulmonary bypass to facilitate heart surgery, and operation is on the beating heart. An immobilization device is used to reduce movement of the area of the myocardium being operated at that time. C. Which strategies help to minimize this hemodynamic instability? Strategies includes good communication between the anesthetist and the surgeon, reduced cardiac manipulation, stop manipulation if there is major hemodynamic instability, the use of shunts to reduce periods of myocardial ischemia, maintaining heart rate at low to normal to reduce cardiac oxygen consumption and reduce effects of periods of ischemia. Correction of electrolyte disturbances, maintaining potassium at high to normal range, and give routine magnesium. Adequate filling guided by cardiac output monitoring. D. Outline the measures that help to minimize perioperative hypothermia during off-pump coronary artery bypass. Measures should comply with NICE guidelines on avoidance of perioperative hypothermia. Preoperative measures includes checking the patient's temperature and using extra bedding or forced air warming if necessary. Intraoperative measures includes monitoring of temperature, reducing periods of leaving the patient uncovered, using warm fluids, forced air warming blanket, underbody warming mattress, heat conserving hat, and keeping ambient temperature at 21 degrees Celsius or more. Post-operative measures includes continued monitoring of temperature, use of extra bedding, and forced air warming as necessary.